When someone presents with what we call secondary infertility, they've had pregnancies in the past, they have children, now the second time around or third time around they just are having problems. We just start all over again, like from square one. We check the male again. He may have been able to impregnate her 5 years ago, but things happen. Maybe his sperm count's low. People get thyroid disease. People get all kinds of things. And infertility is one of those. So we just reevaluate, check the male factor issues, check tubal patency, make sure tubes are open with the x-ray, do an ultrasound, make sure the female hasn't grown a big fibroid or a tumor or a polyp. Check for ovulation, make sure she's having regular cycles consistent with a normal ovulatory pattern. Do a couple of hormone tests, pituitary test. At least give that patient some confidence that they're still probably normal. However, as the female ages, again, we need to remember that pregnancy rates begin to drop at 28. So if this patient's 38 and she has 3 or 4 kids, but it's taken her 2-3 more years of unexplained infertility, it may be an age factor. So there are tests to check for ovarian reserve, which means, are the eggs that are remaining in the ovary still viable? So the evaluation of egg quality, or the evaluation of what we call ovarian reserve, is done usually on the 3rd day of the female menstrual cycle. The patient gets her period. 2 days later, we draw their blood and we check for a few different hormones. We check for the FSH. We check the FSH level. FSH should be under 10. Once it starts going on beyond 13 or 14, that's getting up there. Once it goes over 16 to 20, that's not good. The other hormone we check for is called estradiol, which is a type of estrogen. There are other hormones that can be checked, such as inhibin and Mullerian inhibitin factor. We just began using these other 2 hormones in a panel of 4 hormones altogether. And if you look at these hormones in comparison to a group of 1,000 women who have normal fertility potential, we can tell a patient whether her fertility potential is adequate or not. Sometimes a patient will present, she's 38, 40 years old, she's not getting pregnant. We draw their blood on day 2 or 3 to look at ovarian reserve. It's questionable whether or not she actually has good egg quality. We will send their blood off to a special lab to check for the ovarian assessment through the evaluation of these 4 hormones.